Hello everyone and welcome to Off the Cuff, where the headlines come to life. Have you ever wondered about hair loss and if there was something that you can do about it? Well, today that's our discussion with Dr. William Yates. We are going to be talking about a procedure called follicular unit extraction. Did I say that right?
You got it.
All right. Welcome to Off the Cuff,
Thanks
Dr.
for having
Yates.
me. My pleasure.
What a wonderful conversation. I'm sure there's a lot of individuals, men and women, who wonder about hair loss and who have suffered really a lot of issues and a lot of self-confidence because of their hair loss. A lot of beautiful people out there.
Absolutely.
You are now a hair loss specialist.
That's correct.
But in your other life, you did different things. You are a doctor by trade.
Correct.
And we talked about you being a trauma and cancer surgeon. So.
Sure.
Talk to us about that background and how you
made the transition.
And what a transition.
Okay. Well, I'm from Chicago, and I went to a little school there called Northwestern. I know a lot of people up in Michigan don't like Northwestern with UNM, but went to Northwestern, and when I graduated, my mom died of colon cancer when I was 13.
I'm sorry.
So it really affected me. And so all through school, I did well, and I wanted to be the best doctor there could be to cure cancer. So when I graduated from medical school, I became a surgeon, a cancer surgeon and a trauma surgeon. Excelled at it. I really liked it. But there was one thing that was kind of haunting me personally, and I was losing my hair. I started losing my hair in my early 20s. And my hairline, by the time I was 30, was probably about back here. As you can see now, it's a lot better. And the reason for that was I had a hair transplant. Okay. And most doctors who are regular doctors don't know anything about hair transplants. So you can imagine the regular public has no knowledge about a hair transplant at all. So one night I was watching an infomercial, and I saw these guys, were bald and they got hair. And I immediately just called the number. Now, me being a doctor, you would think I would have checked it out on the internet. I didn't check out anything. I just ran there the next day, had it done, and it worked. So what happened was I got recruited by one of these hair transplant groups to join their group. I joined one.
Now you had this process, which is the process we're talking about, even when you initially got your hair transplanted.
Good question.
Okay.
The process that we're talking about today is a new process. It's called FUE. It's very revolutionary, and we'll talk. And I know you can ask about that later. Sure. But when I had it done, which was about 12 years ago, this process really wasn't out.
Right.
And you had to take a long cut of hair from the back of the scalp. It left a scar, and then they moved that hair from the back of the scalp to the front. That was the process I had. It works. The hair grew like crazy. I still have remnants of a scar in the back of my head that I've had pigment placed in so I can wear my hair short. But nowadays, people don't have to do that because we'll talk about it, we punch the hair out, and it doesn't leave any scar in the back. So when I joined this hair transplant group, this was how I was taught to do it, by making the long cut in the back, the scar method. So of course you get good at that, you get better at it. I did thousands of hair transplants. And what I did was, when this new method came out, like early 2003, 2004, I learned how to do this method probably around 2008. And since 2008, 2009, all I've done is the new method, the scarless method.
But what made you actually transition from being a trauma surgeon and a cancer surgeon and focusing just on, hair transplant? Because I mean, that talent is just amazing as well. And did you ever think of combining them, or is this something that just that just sort of fit what you wanted to do?
That's a good question. I get asked that all the time because some people feel like, God, you sold out. All your training that, and all your professors that have spent so much time. And
not much sold out, but I think that industry, lost a very talented individual and who sounded really, really passionate about it. So I'm assuming this process is just amazing, and your satisfaction from seeing people being, very happy about, what they see is something that has balanced you as well.
Oh, true. And I guess one of the main thing was just to see the hurt that I selfishly had as my hair was thinning. Even though I was a good doctor and I put on my game face every day and didn't let anybody know that it bothered me, it really bothered me. And so just the change that came about just having the hair, the internal change that it caused me to have, I knew there were other people suffering just as bad. So it helped me make that transition from becoming, say, a lifesaver to a life changer, as a hair transplant surgeon. So, I had some remorse, when I first left, because I was good at what I did and I did like it. But it's just as rewarding, being a hair transplant surgeon, because so many people suffer in silence, and you'd be surprised. Nobody wants to talk about it, but they're really hurting inside when you start to really talk to them how much this bothers them.
Absolutely. So when was the transition made from having to have the scar in the back to being able to actually just transplant the hair from the back to the front? I mean, how long has that technology been available?
The real leaders in the field.
I remember the plugs, you know. So and you could tell people actually got a hair transplant.
Right,
so.
and those days are over. And I know, and I showed you some pictures before the show, and you saw nobody had those plugs
and we'll have those up too.
or doll hair. But people started doing the new method around 2002.
Okay.
But it really didn't start catching on steam, I'd say, until maybe last year. Because the because it's a lot easier for doctors to do the strip. It's an easier technically procedure to just cut some of the scalp and sew it up with stitches or staples than to individually pluck out with an instrument every hair. It takes a lot of fine motor skill you can imagine, to hit these hair roots and get them out and transplant them.
So what kind of actual science is involved in this? I mean, it's a year. You're saying that it just, it's just started catching on within this past year. So what kind of new science did we have to look into from going to the scar to actually, and the time frame too involved? I mean, there's a lot of variables there.
True, and really what happened was, starting around 2002, the pioneers in this new method, they had been doing it so long, since say 2002 to say 2010, that the word got out among the public that these guys were having really good results with the process. So the public demand, just like anything else, kind of took over. There was a lot of science behind it. They were starting to write papers to say, hey, this way works just as well as the other way, but you don't get the scar. But of course, a lot of doctors who are used to making the scar like anything, they knew it worked, so they weren't going to change. But like what happens is, when the public gets behind something, then you're kind of forced to change.
Absolutely. So
probably I'd say 2010, 11, and now, the public is so against scarring in general, and it's less invasive surgery, that doctors who don't even really think or believe in it are almost forced now to switch to the new technology, which I believe is better for the patient anyway.
Oh, absolutely. So how resilient is it? I mean, once it's in, can you wash your hair? Can you go swimming? Is it in there permanently, or does it act like regular hair and fall out again?
Yes. That's a great question. People always say, is that your real hair that you're moving, and how does it work?
And you can say yes.
Yeah, and you can say, yeah, it's not a wig, it's not fake anything, it's your own hair. And we take the hair from the back, and this hair is genetically different, or genetically programmed differently, where it doesn't fall out. And we all see that, like men who are walking around the street with a bald head. They're always thin up here, and they always, we call it like the bozo rim. Everybody keeps this rim of hair around here because it's genetically different hair. So it's not that you have a scalp problem. Like a lot of people think, well, your scalp up here doesn't get enough blood supply, or you were nervous, or you think too hard and you shoot the hair out, or something like that. But it's all genetic. So this hair here, you're born with two different types of hair. The hair that's genetically resilient to balding, and the hair that is not. So once this area thins, we're able to go back here, take the hair that's not vulnerable to balding, and we move it up here. And the hair is not smart enough to know we moved it. So however it grew back here, it grows up here. Same, direction, we plant the direction so it grows the same direction that the native hair grew up here. But the same length, the same texture, the same everything, that hair will maintain from the back.
So it's really not the scalp, it's actually the follicle that's being transplanted. So it doesn't matter where you transplant it, it's going to grow the same same way.
You hit it on the head. That's the whole.
That's amazing.
That's the whole science right there. You know, you could write the book. You know, because
I'm an expert now.
You're an expert because it's the follicle. You know, we always say it's a plant problem. It's not a soil problem. So these plants are resilient to any kind of damage. We could take these plants from this area of your scalp, plant them anywhere. Like some gentlemen want beards. We can take hair from here and make them a beard. You know, some people want, you know, mustaches. Some people want, I haven't put any chest hair on anybody, but there are people who we've moved chest hair who have a really hairy chest up to here, because you can use that hair as well.
But wouldn't the texture and the look and everything look so different from your chest hair to your head? I mean, how do you conform that? So it has a lot to do with your artistic vision as well.
Absolutely. The chest hair and the beard hair, of course, is a different texture than the hair on top of your head. So you have to have, you know, put a little art in it to make sure that that hair is kind of hidden. You wouldn't want to put it up in the hairline where people can see the difference in the texture, but you use it kind of as a filler to make a density fill. It works well when people don't have much donor hair to donate, because a hair transplant is pretty much supply and demand. This is the supply, the donor hair back here, or hair they have everywhere else. This is the preferred supply. You want to get this hair first because it's the same texture. This up here is the demand.
Okay.
So
if you're doing all of this, what are the risks involved?
Risk.
The risks.
Right. Every surgery has risk.
Sure.
Okay. And the risk of this are fairly minor because it's like skin surgery. So no one ever has any bleeding problems. So usually maybe ingrown hairs, like people in 2 months, as the hair starts to grow, they can get tiny little pimples in the scalp that usually go away, but if they're persistent, we put them on antibiotics. You know, sometimes people who are very fair-skinned have some reddening of the scalp for 2 or 3 months. But that goes away. It's not like reddening like you've been lit on fire, just, you know, just a little reddening, you know, like a little suntan or something like that. And then the number one thing that's really not a complication or risk, because we do a lot of people who are on TV, like yourself. Not your hair is beautiful, but just like people on TV, and we tell them that you can get some swelling of the face that's unpredictable in that first week. That, you know, I'd say maybe 1 out of 20 people get some facial swelling.
Okay, so take us through a process. Somebody comes in and they let's say they do have a little bit of the hair in the back, and you know they're bald in the front. So what is their process? What do they do from the moment they walk into your office?
Okay.
And then their last appointment, they don't have to go back anymore. What do they have to do to maintain it? You know, what do they have to do to get from that process to that process, and also the screening process? I mean, there are a lot of people who may not be candidates for this kind of thing. So, you know, what do you look for when somebody comes in?
First, how it's done is, you know, person comes in for a consult, you know, just like seeing a regular doctor, which I am. We evaluate their medical history.
That's got to be a plus for people to know that as well. I mean, that you have this history, you know, the medical history that, you know, whatever could go wrong, you're right there, and you've got that covered.
I would think so. So when people come in, we go over their medical history, because sometimes, you know, medicines, different disease processes, you can lose your hair. Okay,
right.
So we kind of rule those things out first. Usually, when it comes down to it, I'm going to say 90% of the people we see lose hair from genetics, purely inherited from your mother and your father. They get together as soon as, you know, the egg and everything is joined. The pattern for your life is set when you're going to go bald.
What about someone that maybe lived overseas and came here? There's a myth, kind of, if you would, that a lot of the men that come from overseas and come here have some kind of reaction to maybe the water that's here, because, you know, that it is treated and what have you, and they lose hair. Is there any validity to that at all?
There's absolutely no validity to that, and I hear it every day. You know, because we do a lot of patients.
You just crushed a myth that we've been talking about for years.
Well, we hear it all the time, and the thing is, it's so coincidental, and they can't prove it, because when they come over here, they come over in the ages they're balding anyway. You know, like most of the men that we see, they're coming over in the college. It's not the water at all. You know, because it's all purely coincidental, and it's all genetic. If they were to have stayed, which at the place they came from, which we can't prove anyway, they would have still gone bald. I'd bet my life on it. I'm that sure about it. Okay.
That's good to know.
Okay, so it's not the water. We hear that all the time. So when they start to say it, I'll say it's not the water. Just
Okay.
they'll start, and I'll say, it's the water.
So you've heard that before.
If I had a nickel for it, I'd be in the thousands, about the water. So when we see the patient, we go through things like that, because those questions come up. The other big question is, I'm under a lot of stress in my hair.
Right.
Like guys will come in with their wife or even their mother or something. They'll say, he's under so much stress, that's why he's losing his hair. Stress can make you lose your hair, but if you don't have the genetic component for baldness, your hair will grow back. So you can have stress and temporary hair loss, but if you don't have that genetic component, that hair will grow back just like it did before.
But if you are under stress and you don't, and you do have that genetic component for baldness, you lose your hair early.
Yeah, it's like putting lighter fluid in the grill.
Yeah,
it's an
that's no
accelerant.
fun.
Boom, right?
Okay.
You just accelerated the process.
So there's some truth to that.
There is truth
then.
to it. Yep. If you have the gene, you're under stress, it will make you lose your hair. When the hair grows back, it grows back thinner, so you get worse quality hair, and you move closer and closer to this baldness. Okay, so we evaluate all those things to see if it's genetic, if it's something reversible, medication, some illness. A lot of times now, say with female patients, there's a lot of autoimmune diseases where they lose their hair, like fibromyalgia, thyroid problems, skin things, different things. There's so many things with this autoimmune, like lupus and all these things where you can lose your hair temporarily. So a lot of people have things like that. So it's a big screening process. And then the other thing is once we start examining them physically, we have to examine the scalp to make sure that it's not a soil problem, that the scalp is not the problem. And then once we say, okay, it's not a soil problem, because like usually people that have soil problems have what's called scarring alopecia. That's from wearing, hairstyles or chemicals or things. It's basically a burn of the scalp. Sometimes we don't know what it's caused from, but we think it's caused from, harsh chemicals, hairstyles which pull the hair, things like that. Because if you have a soil problem, of course the plants aren't going to grow.
So there's nothing you can do with that.
There's some things.
Okay.
we can talk about that later. We got things
Good.
for everybody.
That's great.
Okay, so we examine the scalp. Usually in men, we look for this donor, supply demand. It's all supply demand. Men usually have great supply back here. I'd say 9 out of 10 men will have good enough supply where you can do something to alleviate, at least frame the face. Because everybody framing the face changes how you look. Sometimes we can't, if you're bald from here to here, like do the whole thing because of that supply-demand ratio. But if we can just get hair from here to here and make it look good, that framing of the face will at least take off 10 years, of how you look outwardly to somebody. Now, in female patients, we find sometimes the back, if the front is thin, sometimes the back is also thin.
Right.
Right. So it's a little trickier in female patients.
Especially female patients with thyroid issues who have, who've lost their hair in the front.
Right.
So that's a challenge.
That is a challenge. So we determined if they're a candidate for surgery based on these things we talked about, or if they're not a candidate for surgery. If they're not a candidate for surgery, then we have non-surgical realm that they can go down. Such as there's medications that work. A lot of people have heard of Rogaine or minoxidil.
Do those really work, though,
Yeah.
the Rogaine?
Real science behind it. It works. Okay. Now, the problem with things like that, I tell patients just like brushing your teeth.
Do it all the time.
And they're always like, oh, I don't want to do it. So I tell them, well, stop brushing your teeth and see what happens to your teeth. The older we get to do anything, it's just more work. So minoxidil is one. There's another pill called Propecia that men take, but it's not recommended for women because it alters sex hormones and things like that.
Fun.
Yeah, it's no fun. It's no fun at all. And then there's a laser light therapy, which it works really well for female patients, where it's like a laser helmet that produces laser light. It's not hot light. It sounds like a laser would be like burning to the scalp, but it's not. It's cool light. It stimulates the hair follicle so the hair doesn't fall out and you can grow new hair. That's actually one of the new things that's out on the market, these kind of laser devices to stimulate hair growth.
Is that a continuous process too,
Yes.
or is that you have to keep? See, when you're into those kinds of things, where the Rogaine and what you just mentioned, the cost level really rises because it's something that's maintenance and it's something that you have to do forever. So, but with this process, I'm assuming that it's sort of a one-time thing. But keep walking us through it.
Right.
Here.
Okay. Right. So say if somebody's non-surgical, just like you said, it's a process that continues, because the hair follicle's fickle. It's, if it likes what you're doing and it gets better, if you stop it, it goes back to where it was. So you have to continue whatever that is that's making it better, for these non-surgical things until you don't want the hair anymore. Okay, so now say for instance we say, okay, your donor hair is good, we like what we see, you don't have a soil problem up here, let's plant some hair. Then we figure out, how much hair it's going to take just by doing some math, like measuring length and width and how many hairs it'll take to give you the look you want to have. If your donor's good, we remove that, and that usually takes about 2 to 3 hours for us to remove that amount of donor hair. To do that, it's done under local anesthesia, so you don't go to sleep. It's not like being at a hospital where you hear all that, beep, beeps and all that, kind of take gas and all that kind of, it's almost like a dentist's office. I say it's between the barbershop and the dentist. And it's more toward the dentist than the barbershop, but it's not as bad as the dentist. Not that the dentist is bad, but I mean, it's local anesthesia,
So is this a one visit kind of procedure, or is this a multiple visit type of thing?
It's a one visit type of thing. Now, having said that, most people who get a hair transplant...
Wow, okay. I'm thinking it's a process here.
No, most people who get a hair transplant, they always will come back for more. It's like you tell people, nobody can say you can never be too handsome or never have too much money. It's the same type of thing.
So they want it thicker.
They want it thicker. They want it more. They want more hair. They want it, if you bring their hairline here, they want it down here. It's like getting a house. You get the foundation for the house and you say, oh, I want a jacuzzi in the back. I want to add on a new bathroom. They want to tweak it some more. So most people that have hair transplants, they will want more. Now, the question is, do they need more? That's a personal question for them.
It's almost like plastic surgery,
right?
Too. Do you need more?
Exactly. It's a personal question. I see them. I'm like, wow, you look amazing. And then they'll be like, well, doc, I do, but I want a little more here or there. And this is a guy that was completely bald. Okay, and I think he has hair just combing it like crazy. And I'm like, oh my God, you look Hollywood. He said, and then they come back like, yeah, but. It's always, yeah, but. And then we pull up their pictures and I'm like, yeah, but look at this. And I say, yeah, but, because the mind always takes you back to that baseline you had, because you know how you used to look when you were 20.
Sure.
Now you're 40, 50, 60, whatever. You're getting, like that movie with Brad Pitt where he's the baby and he goes backwards. Mm-hmm. You're doing like that. So you see yourself here. You say, hey, I want to go back here. So they're always chasing something. So we always have to be careful, what we do.
So absolutely. And yeah, there's a cutoff line there.
Right.
But I am still amazed that you walk in, bald, and you can actually walk out the same day and you're completely done. So there's no there's no maintenance involved. I mean, there's no medication you have to take, nothing that, to maintain. You just go in, walk out, you go swimming, you do whatever you need to do, and you What about women and styling their hair? I mean, is that something that you tell them to be careful with, or is that a natural process too?
To answer the first part, for the first week after we plant the hair, you got to be careful. So it's no, heavy physical activity, swimming, things like that for the first week. After the first week, you forget you have it done. The hardest thing about a hair transplant, it's literally like watching grass grow. It takes about 10 months to really get results. So everybody wants results like, walk out the next day, boom. It doesn't happen like that. Okay, so it takes 10 months. Women, as far as styling hair and things like that, once the hair grows in, they can do whatever they want. But whatever got them into trouble, like if they were using too much dye or bad hairstyle, we advise them don't do that again. But we try to keep it simple.
But there's really no life change involved in terms of any kind of process.
No
or
maintenance,
kind of maintenance or what
no
have
special medicine that I sell that makes my hair grow, that they have to get, or it's not going to work.
Well, now you're based in Chicago.
Yes.
And you're thinking about coming in the Metro Detroit area as
yes.
well and bringing that technology here. I mean, I'm not quite sure. I'm sure that there are other individuals that possibly, do what you do. But this sounds really amazing, and it sounds that you're very focused and emotionally speaking and physically speaking on the well-being of those patients that come in. What I really thought was amazing when you showed me the picture of the gentleman that wanted the beard that had a little hole there, and you were actually able to maybe put that on the screen as well. But this process is really amazing. It's a long way from the plugs that you used to see. And you're also planning on doing a show regarding this whole process. Talk to us a little about that. Today's Medical Network with Dr. Yates.
Yeah. Well, thanks for bringing that up. I'm hosting a medical show, and every week we're going to talk about a trending topic in medicine. Now, since my background is so broad,
and that was my next question.
Like I'm a trauma surgeon, and I took care of an ICU. I've done it all. I did bariatric surgery. That's the slimming surgery. So I've seen kind of everything in medicine. So we're going to talk about trending topics in medicine, things that are hot today, like vaccinations or genetically modified food, or everybody now they say, oh, my foot hurts, I got a headache, oh, I ate gluten. They blame everything on gluten.
Absolutely. And I think that is the trend. I think we went, as a society, we went through a process of junk food and not really caring, to now I think we have more of a social conscience, and a medically social conscience as to what we're consuming and what we're eating, and the effects of all that stuff. So we'll definitely look for that show, Today's Medical Network with Dr. Yates.
Yeah.
Sounds exciting. Sounds very, very informative. And follicular unit extraction. To me, that's amazing to me. How you can lose something naturally and then bring it back in that kind of way. So I'm sure a lot of people would be interested in exploring that technology. Dr. Yates, thank you so much for being with us on Off the Cuff. It's been a pleasure to talk to you. Very interesting stuff. And thank you for being with us on Off the Cuff. Dr. William Yates, everyone. Take care.